Good afternoon, everyone, and welcome to the first Zoom session of our 2021 Science and Health Live event. My name is Sarah, and I am the Engagement Manager at Cardiff University School of Medicine. Now, this Guest the Healthcare Professionals session is new to our programme and is 1 hour of fun and interaction to highlight the breadth and some of the very interesting healthcare professional roles that play a vital part in today's society. Today, I am delighted that we have 4 professionals working in different healthcare occupations, and your job is to try and guess the right profession for each of our guests. Each guest will inform you of the A-levels they took and do a short mime of an aspect of their occupation. I will then ask our guests the top 4 yes/no questions that you have put in the Q&A. Due to the limited number of questions that can be put to each of our guests at this stage, please can I ask that you use the like button, as I will aim to ask the top 4 most popular questions. After this, I will then invite you to guess the right healthcare profession from a list of possibilities via Mentimeter. So hopefully you will have a second device at hand to be able to take part in our live voting. Right, we're going to get straight down to business. Lisa is up first. So Lisa is going to let you know her A-level qualifications, and she's also going to do a short mime of an aspect of her occupation. Can I ask, while Lisa is doing this, please can you put your yes/no questions into the Q&A so we are ready to ask those questions of Lisa once she's done her mime. Thank you, everyone. Over to you, Lisa.
Thanks very much, Sarah. So my A-levels were chemistry, maths and physics. So as you will see from my acting skills, there was definitely nothing creative in there at all. But here is my mime about my job. There you go.
That's lovely, Lisa. I'm desperate. I want to see it again. Fabulous. Right, so we've got a couple of questions in the Q&A. So these are to be answered with yes or no, simply. Did you go to university for 5 or more years?
Yes.
Yes. And a second question is, do you work mostly with patients?
No.
Thank you. That's a good question. Lots of questions are coming in. I'm just going to try and choose. Another good question. Does your job involve research?
Yes.
Another good question is, do you work at a hospital?
Yes.
I know, so it's tricky to just answer yes or no. Can I ask, is your work office based?
Yes.
Right. There's actually so many questions here. Do you use specialized machinery in your role?
Ooh, that's a good question. Probably no, given what I think you might be asking.
Okay, that's fair enough. That's fair enough. Very interestingly, someone has actually put the right answer in this case. So I'm just going to hold off on that. Oh, another good question. Do you research infections?
No.
Okay. Right, I think we are going to now guess your healthcare professional. I'm just going to share my screen. Where is the... Oh, apologies for this. I'm trying to look for the right screen and can't find it. Right. Here we go. Apologies for that. Okay, can everyone see that? So if we go to, you have your second device hopefully at hand. If you go to www.menti.com and use the code 97902043, can everyone then decide what they think Lisa's profession is? And there's a selection of choices that you can choose from, including GP, epidemiologist, pediatrician, radiographer, psychologist. Oh my goodness me, isn't this amazing? Right, quite a lot of you are an epidemiologist. And I'm going to hand over to Lisa now to reveal your role.
I am indeed an epidemiologist. Maybe my acting skills are better than the questions that gave it away.
I think they are fantastic, Lisa. And I think we just all want to hear just a bit more from you now on just giving us a summary of the role of epidemiologist, if that's okay with you.
Yeah, that's fine. Can I share my screen?
Yeah, I'll just stop sharing mine so you can.
So I have some slides. They're not exciting. They are more to remind me of what I was thinking of saying. So before this session, Sarah asked us to consider 6 different aspects of our role. And that's what I've tried to do within these slides, just to tell you a little bit more about what I do. So maybe a year ago, not that many people would have heard of epidemiologists. Certainly, I used to get asked a lot whether it was something to do with skin diseases. I think because epidermis is one of your skin layers. But actually the word is related to the word for epidemics, which is why lots of people have now heard of what we do. But we study the health of populations. And this has obviously come to the fore with the current pandemic, because both types of the work that we do has been really important to study COVID. So we do 2 things. We either just observe what's going on in the population. So for COVID related work, that would be some of the work on working out how many cases there are in the population, or trying to work out who in the population is more at risk of getting COVID. But the other aspect of our work that we also do is we do intervention-based studies. And this is where we actually intervene in some way. So I guess the best COVID example of this is the vaccine studies that have brought us so far along now with our response to the pandemic, where we go into a population and we change something and we compare the people who've had the intervention without the intervention to see whether or not that's a useful intervention. So the main aspects of my role are reviewing evidence that already exists. We don't want to do new studies if plenty of evidence already exists. Once we have ideas for studies, we apply for funding for those studies. We then design, conduct and analyse the studies. And then a very important part of our role is to communicate about the results of the studies, including discussing how the results of our studies should lead to changes in practice. We also work collaboratively all of the time. So that's a very key part of our role, working with different teams, with different people in different roles to make sure that we've got the right group of skills within our studies. The role will differ a little bit depending on the institution that you're working in. So I work at the university. So my role involves both doing research, but also teaching. Teaching both medical students and postgraduate students and doctors during some of their training courses, mainly teaching them about epidemiology and evidence-based medicine. But if you are an epidemiologist, there are also other places that you can work. You might work for a public health organisation such as Public Health Wales in Wales. The government has epidemiologists. Non-governmental organisations often have epidemiologists out working in the field. So there are lots of different places where you can work as an epidemiologist. The second question Sarah asked us to look at was what training we needed. There are lots of people from lots of different backgrounds who work in epidemiology. My background is in medicine. But the key thing is that you will usually do some sort of postgraduate training to then become an epidemiologist, either through a training programme such as the public health training programme, where now actually you don't need a medical degree to join that programme, or some people will get into it by doing a postgraduate degree, either a master's or a PhD. And more now, because of the different kinds of data that we use, more and more epidemiologists have some kind of data science training as well. So the best bits about my job are that I really enjoy the fact that I feel like I'm answering important questions. There's a huge variety of different projects and tasks in my role. It's a very flexible career path. I didn't take a direct route. I've been on all sorts of meandering routes to get where I am today. And I think that's a real advantage of this kind of job. I feel like I get the opportunity to work with amazing people and also to travel all over the world. So I've worked in Ghana, I've worked in Bangladesh. We go to conferences, although not at the moment, and who knows whether we will in future. But we also travel a lot to have collaborative meetings. And I also really enjoy the teaching aspect of my work as well, particularly because I think now medical students can really see how important it is to really be able to understand epidemiology. The worst bits about my job are that working with data can sometimes be a bit frustrating, but that's also quite the fun of it too, I think. It's constantly like solving puzzles. The main frustration is obtaining permissions to access data, although during the COVID pandemic, this has been made a little bit easier. So hopefully in the future, this will become better and a little bit more flexible. One of the things I really struggle with is that I feel that there are too many interesting questions to work on. And so having to focus on a few narrow questions, I find really hard. And also the funding environment is very competitive. So you do have to get used to rejection in this job and always have a plan B. The working environment, well, since March 2020, my working environment has been my kitchen table. So as you've worked out already, my work is mainly desk-based and it's been very easy to adapt to working from home. Usually I'm based at university within one of the research divisions in the School of Medicine, and we're located on the hospital site, which is why I sort of work in the hospital, although I don't actually do anything with patients in there. Although the vast majority of my work is desk-based, I get plenty of time away from my desk to teach, meet with people, develop collaborations, present do all sorts of different things. So I don't feel like I'm tied to my desk, usually. And then the key skills and attributes that you need. I think you do need to be someone who likes numbers and who isn't frightened of numbers to do this job. You definitely need to have attention to detail and be slightly obsessive, in fact, about detail. Curiosity is definitely a key attribute. I think you need to be able to think about problems and try to work out how to solve them. Communication is a really important skill, both orally and written, and actually communication with lots of different people. So you could be presenting on some days to members of the public. On other days, you could be presenting to the chief medical officer, and you need to be able to pitch your communication appropriately. And I know I've spoken a lot about collaboration, but I think that a desire and an ability to work collaboratively with lots of different people from lots of different areas is a really key skill to have for this job. That's me done.
Thank you, Lisa. That is fantastic. There are a few questions in the Q&A. We haven't got time for them now. I'll see if we've got time at the end, but maybe if you have a chance and you can look at them, there's some questions.
I can reply. I'm happy to reply as the others are speaking.
Thank you, Lisa. That's wonderful. Thank you again. Right.
Pleasure. Thank you.
We're going to move swiftly on to Tom next. So Tom, hopefully we'll be able to see you soon, and you will be able to tell us your A-level results, your A-levels that you studied, sorry, and do a short mime of your occupation.
So I didn't actually study A-levels.
Oh, well, there you go, just maybe.
I studied the International Baccalaureate. So I had to try and remember exactly what I studied in the International Baccalaureate. But I did high-level physics, high-level English, maths, Spanish, peace and conflict studies, and something else which I can't remember for the life of me. And that's alongside theory of knowledge as well, in terms of my subject areas for the IB. And a mime.
Yes.
It's about as best I can do.
Wow. That was brilliant. Fantastic. Right, I'm going to look in the Q&A now and see if we've got any questions relating to Tom's profession. Oh, some are saying that they couldn't see the mime. Would it be possible, Tom, for you to do that again? Okay, I actually get it now. So we have a few questions. Is your role 24/7?
Yes.
Okay. I love this one. Are you a rocket scientist? I think your mind may be a...
No.
No. Oh. Ah, my gosh, yes. We're getting some guesses, and I can say that one of them is right. Do you work directly with patients, Tom?
Yes.
Is your work office-based?
I can work in multiple different places.
Okay. I'm going to mention some of the things in the chat. Do you do things with hurricanes is one comment, which is quite funny. And we have got a few suggestions in here. Do you fly?
Yes, I do.
Right, I think we can go to the guests now. I think quite a few people have actually got the right answer. So I'm just going to direct you back to Mentimeter. We need to move on from Lisa. And now, what do we think Tom is? Out of the suggestions we have here, it might not be, people are, might not be completely obvious, but I think it is obvious. So the majority are going with critical care practitioner, Tom. Will you reveal to us what your role is?
That is right. I'm a critical care practitioner.
Brilliant. Well done, everyone. That was really good going. Tom, we'd really love to hear a bit more about this role. So if you're happy to share with us, a summary of your role, that'd be great.
Yeah, sure. So I'll try and share my screen, and
let me just stop sharing.
I've got prompts then that I can use. There we go. Can you see that?
I think it's coming.
It's on full screen on my screen, so I don't know whether it's...
I've just got Thomas has started screen sharing.
No.
Same.
If I can't do it, then it's not to worry. Don't know if that's come up.
No, it hasn't. Sorry, Tom.
No, don't worry. So my role is with the Wales Air Ambulance.
Can you put your... Oh, brilliant.
There we go. Back again. So I've flown with the Wales Air Ambulance for the last decade as a critical care practitioner. I work multi-site, so I can work from Cardiff, where we cover 24-hour nights. Llanelli, we cover days. The aircraft in the south, we cover pretty much from Aberystwyth, come across the back mountains down to Monmouthshire. That's our patch. We've got another aircraft then in Welshpool and another aircraft in Carnarvon. And so we basically split into a team where we'll have a pilot, a critical care practitioner, and a consultant from varying backgrounds. But in regards to the crew, we are the permanent staff, if that makes sense, for the air ambulance. So the consultants will come in and do maybe 2 shifts a month to kind of make up the team in that respect, whereas we are continuously kind of working for the Wales Air Ambulance. So it's a mixture of private industry, which is Babcock, who supply the pilots, the aircraft, the engineers, etc. The NHS, which is us and the consultants. And then the charity aspect, which is the biggest thing, because it costs £8 million a year to fund all 4 aircraft in Wales. In terms of my background, I was a paramedic by background, but CTPs, as they're termed, can be from a nursing background or a paramedic background. Generally, we will always go for people who've got a lot of experience before they come into our unit, and so the selection process is quite rigorous. So for every position, we have probably about 75 applications for each position, and then you'd expect to have somebody at a master's level, so you'd have to go and undertake a master's, which is where I come into Cardiff University, because I lecture for the postgraduate critical care masters. In terms of other areas that we get, so we get everywhere basically in healthcare. So whether it be similar with epidemiology in terms of kind of researching kind of disease processes, my specialist area is out of hospital cardiac arrest. So I have a lot to do with that and work quite closely with Welsh Government on looking how we can improve the survival rate. So I get to do my research side, which keeps me kind of intellectually happy. we get to go we get seconded off into the NHS in places. So I spent a year looking at peer review across all the different networks. So from the neonatal network to the child adolescent mental health network to the cardiac network. So all these big different areas, which is generally because the background that we have is that we'll work with patients, whether they be neonatal patients, whether it be the elderly, whether it be trauma, whether it be medical. We get a nice mix of patients to work with. Trying to think what are the things you'd be interested in to know, because it's quite an interesting job. It's dealing with the predictably unpredictable is the best way to term it. So I start at 7 o'clock in the morning, and then where I go and what I do and who I see in between all depends on the 999 calls that come into Wales. They all get filtered, and then we're tasked to the most serious critically unwell patients, whether that be medical patients or trauma patients. And that can be pre-hospital from the scenes of accidents, or it can be retrieval, which is a big element. So we're likely to kind of go off to some of the smaller hospitals and help stabilise patients and retrieve them back to some of the main hospitals in Wales for specialist interventions.
What, Tom, would you say are the best bits of your job?
I'll get to fly around in a helicopter. That's got to be that's got to be one good thing. It's a nice view. So I think, well, for me, I've been around it for a number of years now, so I'm not too phased about flying around in helicopters. I actually prefer being in the response cars in the city centre. I enjoy that, probably because I can go to kebab shops and things like that when I'm hungry.
Fair enough. And what would you say are the worst bits about the role?
There's various interesting bits. I think that evidently we deal with a lot of death, and I guess it's kind of generally people's worst day of their lives is something that we have the privilege to be able to enter into and try and, you know, help in the ways that we can. We carry a lot of advanced kind of medical equipment, can do a lot of advanced interventions. So we carry blood on the aircraft. We can do some advanced surgical procedures. We deliver a lot of it is delivering anaesthetics, putting people to sleep and stabilising them. But evidently, you know, we have to deal with not just the patient, but then also a number of bystanders, family, etc., at the same time as dealing with medical things.
Thank you, Tom. That has flown by. There are a few questions in the Q&A. If you wouldn't mind just maybe having a look at them. There's some really good questions about, you know, the strangest place that you've, you know, had to go to and so on. But thank you so much for that. We're going to move on now to Emma. Emma, are you there?
Hi, Sarah.
Hi. Right, Emma, are you ready to tell us the A-levels that you studied and showing us a short mime of your occupation?
Okay, so A-levels, I did chemistry, biology and maths. I may send the profession back a decade by doing this, but here we go. No. There we go.
Wow.
What's the easiest I can get to?
Did everyone see that?
I can do it again if you want me to.
Yeah, do it quickly again. Oh my gosh. One of the first questions is, do you deal with prescriptions?
Yes.
How on earth? I'm so impressed. So yeah, we've got a few. Do you deal with patients?
Yes, we do.
Yes. Do you work in a lab?
Oh, okay. We can do. I do, but others don't.
Yeah, so another one to work with medication.
Yep.
Yeah. Right, I'm going to go straight to the Menti screen because I think everyone here has a pretty good idea of what you do. Let me just move this along for a second. So everyone, what do you think Emma does? What's her role? And I know a lot of you have already put the right answer in the Q&A.
Excellent miming skills, you see.
I'm just so impressed by the acting skills of you all so far. This is amazing. Right, that's unanimous. Fantastic. Emma, that's brilliant. So again, we just love to hear a little bit more about the role of a hospital pharmacist from you, if that's all right.
Yeah, of course. I'll try and share my screen.
Yes, hopefully
Have a look.
be able to do.
Okay, can you see that? Great, and can you just see the slides and not my notes? Great. Okay, so I'm sure everybody's been to a pharmacist or pharmacy at some point in their lives. So effectively, the best definition I can get down to is that we're a healthcare professional who are focused on the safe and effective use of medication. Now, we do a lot because the role is actually changing, which is great. So I've just listed a few things just on the slide that we do on a kind of a daily basis. And that kind of focuses on counselling of medications, particularly if they're high risk. So I work in Morriston, so we're kind of a cardiac centre. So we see a lot of people started on drugs like warfarin. So patients need counselling. Another key kind of element is interpreting kind of interactions between different medication and interactions between medication and food. And we also offer a lot of services. So for example, stopping smoking, blood pressure, vaccinations, that's kind of done in the community. And then obviously we're there to provide advice as well on doses of medications. Patients can be obviously children, elderly, have problems with the kidneys, problems with the liver, and all of these will affect doses of medication. So in terms of key skills, you kind of need, like all professions, you kind of need a lot of skills. So I kind of narrowed them down. First thing I would say, you do need to be quite responsible. You are dealing with patients, and obviously you're checking their medications, so you do need that. Communication is key with pharmacy. You need the ability to speak to patients in a language that they understand, but then kind of flip your brain because you're also talking to consultants. So you need to be able to speak to them with a language that they understand as well. As Lisa said previously, again, maths is important. We have to calculate doses, rates of infusions, things like that. And then finally, I would say integrity is quite an important one because, again, you're dealing with members of the public. And if you come across a problem, you kind of need the self-confidence and the integrity to kind of stand up and ask questions with respect to prescriptions. Okay, so how do you become one? So A-level subjects that I did, as I mentioned, with maths, chemistry and biology. I also did art for an AS level, but that was a lot of fun. So in general, I'd say do your research, look at the different kind of pharmacy schools on what they require as entry criteria, but generally it's at least 2 sciences and maths. So once you're into university, it's called the M.Pharm degree, Master of Pharmacy. It lasts for 4 years. Your final year is your integrated master's year. And then following this, you do something called a pre-registration training year. So this is where you spend 1 year in clinical practice. This can be community, hospital, industry, and they're even starting to kind of bridge the gap and you go to primary care as well. After that complete year, you do the pre-registration exam. So you have to do part 1 and part 2. One's a maths paper, one's a clinical paper where you just show off your clinical knowledge, but you have to pass both and you have to pass the calculations at 70%. Once you've done that, you're able to register then with our kind of governing body, which is the General Pharmaceutical Council. And every year then you have to do continuing professional development and then renew that registration. So I work predominantly in hospital pharmacy. I'm also doing a PhD, so I only work back in Morriston kind of Fridays and weekends. But in general, we do a ward-based service, so you tend to be allocated 1 or 2 wards, and you just go to the ward, see what needs ordering, see all the new patients first, have a chat with them about what medication they're taking, get an accurate history so we can continue the care whilst they're in with us. If they're, again, like I said earlier, if they started a new medication, we go and counsel them on it. And we just clinically check each medication to check that the dose is okay, that there's no interactions. And that's really it with base ward services. And obviously we process the discharges. Now, on a daily basis, I can get a dispensary slot. So usually we do an hour in the dispensary, and we tend to get outpatient prescriptions. This is prescriptions from A&E, or if patients have been seen in the clinic, we'll clinically check and manage those prescriptions. But we'll see a lot of hospital charts as well. And then counselling, so if somebody starts on an inhaler, we do a lot of inhaler techniques, and like I said, other high-risk medication. Now, in general, pharmacy is kind of evolving a bit, I would say. So you can work in community, you've got the industry, there's even prison pharmacists, there's veterinary, you can go into the military, there's just a lot of kind of variety with the role. So coming on to the best and the worst bits, I try to give my top 3. So I'll start with the best bits. So obviously you can make a real impact in patients' lives, particularly they've obviously come in with some form of illness, and you can help that get better, really. Now, I've put members of the public in both because I've had some genuine laughs from members of the public. They've been fantastic. And then I've also got variety. Like I said, pharmacy is evolving and no day is the same. So one day I can be covering cardiology, the next you could be covering pediatrics. So it's very varied, which is what I quite like, to be honest. Then kind of on the flip side to that, we are working in a hospital. So you do tend to see patients in their worst kind of state of health. And you do tend to see quite a few deaths. And that can be quite hard, particularly if you've built up a relationship with that patient. Then you've got members of the public, so they can be quite rude sometimes and argumentative. But then again, you've got to kind of think they could have been given some bad news, relatives might be in A&E, so it's just part of the job. And then finally, my favorite is Dr. Google. The number of times the hours I spend on the phone to people who said that Google's recommended some herbal medication that will treat their illness and they want to stop their medication is beyond a joke. So that is a real bugbear. But that's about it. I'm hoping that works.
Thanks, Emma. There is we just got one time for a quick question from the chat. What particularly attracted you to pharmacy?
I get asked this question quite a bit. I just liked science in school, so I knew I wanted to go into some form of science-based career. And I actually did a lot of work experience. So I spent some time down in Prince Philip in Llanelli, or Carmarthen Way, shadowing some medics. And I also did some time in Lloyd's Pharmacy. And I preferred the pharmacy over the medics. But also, I think just thinking long-term, pharmacy is, you can kind of have like a 9 till 5, community's a little bit longer. They do like 8 till 6. So that suited me better, personally. It's kind of personal preference.
Thanks, Emma. There's quite a few questions in the Q&A, so if you have got a chance to look at them, we might have some time at the end for more open questions for all 4 of our guest professionals. So, but yeah, if you could have a look in there as well, that'd be great.
Of course.
Thanks, Emma.
No probs.
Right, we're going to move on now to Martin. Martin, are you there? You're on mute, Martin.
Yeah. Sure. Hi, everyone. Okay.
Yes, all is good. Are you ready? Are you ready to hit us with your...
I'm ready. Yeah.
So, did you do A-levels, Martin?
I did a long time ago, and I had to write them down so I could remember what I did. So I did law, biology, French, and sociology.
Okay.
And I was at my first degree was at university, and I was at university for 6 years studying anthropology.
Wow.
And that's nothing to do with what I do now.
Yeah, I was going to say, where did that come from? Anyway, so we'd be delighted to see your mime of an.
My mime. Okay,
Of
don't
what?
blink because don't blink because you'll miss it.
Okay. Okay.
That's it.
Right, everyone. Can you put your yes/no questions into the Q&A for me so I can put them to Martin? I've got a question for you, Martin. Do you work directly with patients?
I do, yeah.
Okay. Oh, some people are saying maybe they didn't see. Can you do that mime again?
Yeah.
Okay. Hopefully that will have worked. Do you use specialist equipment to do your role?
Yes, highly specialist.
Okay. God, today's audience are just amazing how they are guessing the profession straight away. I'm just amazed. And are you occupied with a certain technique, would you say?
No, the techniques I use are very varied.
Okay. And is your profession 24/7?
Yes.
Okay. I think that is, I think there's already a lot of right guesses in the Q&A. So once again, I'm going to go to the Menti slide to allow everybody to vote on what they think Martin is. So everyone, if you can go back to Mentimeter and start voting. Wow. I'm just so impressed, everyone. You just really Martin, please reveal to us what your role is.
I am indeed. I'm a radiographer. So you're spot on. Well done.
Fantastic.
And what I was describing in the mime there is the way in which I use a piece of equipment which limits the amount of radiation that the patient has when I'm taking an X-ray. So it's moving collimators and pieces of lead into place. So did you want me to share my screen now?
Yes, please do, Martin.
Oh, okay, let's see if this works now.
About the role.
Sorry, bear with me 2 seconds. Can you see that?
We can see the screen, but I don't think it's your slides, Martin.
Oh, okay. Let me just... There
There we go. That looks good.
See it now? Yeah?
Yeah.
Okay. So if I just... Okay, so so I work as a radiographer. I'm a diagnostic radiographer. There are two kinds of radiographers that we have within the NHS. That's diagnostic and therapeutic. So therapeutic radiographers only work with patients who have cancer and provide radiology for them. Diagnostic radiographers are responsible for diagnosing different diseases and illnesses. And whether you can see there in that first screen, the little sort of enlarged picture down there in the corner, those two little dials on there, that's what I was controlling to control the amount of radiation that the patient was going to have. So I am a radiographer, but I also play a role in teaching radiography. So I teach radiographers on the undergraduate program here in Cardiff. It's a 3-year full-time program. And what's lucky is you can have your tuition fees paid for you by the Welsh Government. So there are no tuition fees for health-related courses such as radiography. Now, the majority of our work is what's called projection radiography. In other words, some of the x-rays that you may well have had when you attended hospital. So you will have x-rays such as a chest x-ray there, a hand, a foot, an ankle, we've got a face, and we've got a pelvis. So we do a lot of that, what's called plain film imaging, and there are very few patients that come through the hospital doors that do not come to us in radiology. Most other professions rely on the radiology department to be able to identify what is the matter with this patient. You'll hear two terms, a radiographer and a radiologist. The radiographers do not have a medical degree. So I do not have a degree in medicine. I have a degree in radiography. The radiologists are doctors who are either surgeons or medics by training, and then they could go on to do postgraduate work in radiology. So we image the patients and they then will interpret some of those images, although things are changing, and I'll talk a little bit about that later on at the end of my talk. But it's not just about normal projection x-rays. I can also image patients using CT, computer tomography. I can use an MRI scanner, which is literally putting someone into a massive magnet and playing around with their hydrogen atoms. I can use ultrasound to detect abnormalities in the body. Ultrasound is often seen as the safe alternative because we don't use any radiation when we're imaging a patient with ultrasound. Also, MRI, we are not using radiation, it's just a magnetic force. We can also inject patients with radioactivity and follow that radioactivity through their body, and that's called nuclear medicine or radionuclide imaging. We can also image patients and get live images, so we can observe and perform small surgical tasks. So for example, if someone has a blocked coronary artery, then that blockage will be relieved under the control of the radiologist using imaging that the radiographer is producing for them. So some activities that used to go for surgery, we now are completing those in the X-ray department. And then we get nice images like that. So we can see a slice through a CT head scan. We can see an MRI of the lumbar spine. MRI is really, really good at showing soft tissue. We can see a bone scan on a patient who unfortunately has got spread of bone cancer or spread of cancer from a prostate cancer into their bone. We can see ultrasound there, and a lot of you will associate ultrasound with imaging of babies in development. And then you can see a very odd image down there, which looks like a road map, and that's actually your coronary artery. So the radiographer has imaged contrast or dye in the patient's coronary arteries, and we can follow that and identify where there may be a blockage and where they may need to put a stent in. And a bit like we heard Tom earlier on, a significant amount of the role of the radiographer is involved in accident and emergency. So that's really where our 24-hour-a-day, 365-day service of the ED department comes in. So when Tom brings those patients in off the helicopter from major trauma, they will have multiple injuries. They will probably need CT to check they haven't got a broken neck or any severe injuries. And that then becomes our job to provide that imaging to the trauma team. So it's a really exciting, well, a very exciting role. It's a massive adrenaline rush. And then I talked about that link between the radiologist and the radiographer. We have in the UK at the moment a shortage of radiologists. So there are not many doctors who are additionally qualified to report images. And therefore, in some areas, the radiographers have gone back to university to do their postgraduate study, their MScs and their PhDs, to do some of the work that the radiologist has done traditionally. And that's what I did. I went back to university after doing my degree in radiography, and I became a reporting radiographer. So images like traditional X-ray images, the images that we would get from the ED department, all the fractured bones, I would sit down and report those rather than have to go to a radiologist. So, you know, thinking about the best bits of my job, no one day is the same. You might X-ray a person's chest. You might do a chest X-ray 20, 30 times a day, but every patient is different. Every pathology is different. And you image from the smallest babies in the special care unit right up to patients who are 80, 90, 100 years of age. We span all age ranges. The challenges of my role, I think, you've got to be prepared to work 365 days of the year. It's not the kind of career that you can walk away at 5 o'clock. You're going to be working, as our pharmacy colleague just told us, you're going to be working Saturdays and Sundays. You're going to be working all the major bank holidays and 24 hours a day. But it's great. It's really different. The hospital environment at night is a very different environment. And that's really when I think the teamwork of the hospital really pulls together. It's when it's out of hours or when you're given a situation like a major trauma. So in terms of the skills, fundamentally, we care for patients. So our skills have to be focused around compassionate care. We have to be able to provide care directly to patients. They are directly in our care. But, you know, teamwork is essential. In terms of your academic background, we look for you to have 2 sciences at A level, one of which may be psychology, because understanding how people think and how people may react in situations of trauma or if they're not well are just as important as some of the harder scientific subjects like chemistry and physics. We do study physics for 1 year in the first year of the programme. We have to know how X-rays are produced and how those X-rays interact with the body and what the damaging effects of those can be. So I will stop sharing now. Has that stopped, Sarah?
Yes, it has.
Yeah.
Thank
Okay.
you, Martin.
Sorry.
That's wonderful. Thank you. Thank you very much. We have a few minutes. So if anyone would like to ask a question of Martin, Tom, Emma or Lisa, please can you put your question into the Q&A? Or we're happy if you want to raise your hand and you can ask your question directly, we could do that also. We have a question here for Martin. What is your favourite scanning device to use?
Okay, so one of my favourites is nuclear medicine. So nuclear medicine, we are not interested really in patients' anatomy. We are interested in patients' physiology. So it's the odd imaging modality in the whole of radiology. Everything else is really detailed pictures of anatomy. But I used to do nuclear medicine and I had a particular interest in what's called SPECT imaging. And that was looking for early signs of dementia in patients, as well as looking for early signs of Parkinson's disease using a specialized scan known as a DAT scan. So nuclear medicine was probably my big interest area.
Thank you, Martin. There's a question here for Tom. Tom, how did you find your application to university being an international bac student?
So at the time, the International Baccalaureate wasn't that well known in the UK. And so the offers that we were getting were fairly low. So in the kind of 30 points kind of range. And I think not many universities understood what the International Baccalaureate was all about, especially because it had so many different components in terms of subjects, as well as, and it's probably the reason I ended up on a helicopter, was because it had service to the community as well. And so a lot of the time was spent doing that. And I did that on with the RNLI on a lifeboat. So that helped me actually probably get into the specialist niche area that I wanted to do. I think nowadays, the IB has a lot more awareness around what it's about, and you have things like the extended essay, which you wouldn't traditionally do in A levels, which I think helps as well. It allows you to start writing longer academic pieces. So I'm kind of fairly lucky. I kind of think I kind of went for the right choice when I did the IB.
Thank you, Tom. Lisa, we just have a quick question here for you. What has been your favourite study that you've researched so far?
Oh, that's a very good question. Because I love them all. However, I guess the one that both allowed me to live in Ghana for 18 months and also was probably the one that has had most impact was a study of maternal vitamin A supplementation during pregnancy. And the question there was whether or not this reduced maternal and infant deaths. So we had around 200,000 women taking low doses of vitamin A regularly every week, and we had to then go around and collect data from them. Yes, we showed that it wasn't impactful at all. And that was really important because there'd been one study in Nepal that has suggested that it had a massive effect. And the suggestion was that this should therefore be given to all women in low-income countries, which would have been a huge waste of money. So it's probably that one, both because of the work, but also because of the experience I had living in Ghana.
Thank you, Lisa. And Emma, I don't want to leave you out, but did you happen to do work experience in a pharmacy while you were doing your A levels, before you went on to university?
So I just did some work experience. So I did, the way my timetable worked in schools, I had every kind of Wednesday morning free. So I did every Wednesday morning in my local Lloyd's pharmacy for about a month. Just because we knew the pharmacist, it was just kind of a way in, but I always tell the undergrads, or the prospective kind of students, if they can get experience, it's a good thing because you kind of work out whether or not the profession is suited for you. But I did then get a job as a counter assistant during uni.
Thank you. Thanks all of you. I'm just quickly going to go back to Menti. I hope everyone is still got their second device ready, just to give us some quick feedback on this session, and just to let us know if now after the session, do you know a lot more about the roles featured, know a little bit more, or you knew it all before. So it's lovely that you, the majority of you on this webinar, know a lot more about the roles that we have featured today. I'm quickly going to also move on to the next question that we have. And do you think this session was brilliant, good, okay, not good, rubbish? And again, we're very grateful for your feedback. Thank you. While we carry on feeding into Menti, but I just want to say a huge thank you to Lisa, Tom, Emma and Martin. Thank you so much. And thank you to all our attendees today for being absolutely amazing in guessing the right healthcare professional. I've been completely amazed how quickly that you got the right profession. So thank you very much. And just to let you know that there is another session straight after this one, which is fantastic and gives the opportunity to put your questions to our panel of COVID-19 researchers. Tomorrow there's also another 2 live sessions at 3:30. There's an opportunity to put questions to the researchers that have supplied some of the pre-recorded videos that have made up this year's programme. And then at 4:30 we have a panel of undergraduate medical students and postgrad students that again you can put your questions to. So please make the most of this opportunity to ask lots of questions, as they can really help you to make informed decisions about your future. And also, I just want to plug the competitions as part of this year's Science and Health Live event. We have a quiz which has amazing prizes, and we also have a Science and Health TikTok challenge if you're up for it. And again, this has some prizes attached to it. So fill in that quiz and get those TikTok challenges to us. That would be great. Thank you all again, and I'm going to hand over now to James, who's chairing the next session.